Department. And Adam's presentation is titled Measuring Health at Home, Community Health Assessment of Anaconda, Deer Lodge County. So Adam, take it away.
Awesome. Thank you, Lee. So as Lee said, my name's Adam Maes, and I worked in Anaconda. I am originally from Anaconda, in case anybody's wondering how I ended up there. So this project meant a lot to me just because it is measuring the health at home. So now I live in Helena, but I'm originally from Anaconda. So just a little background on the county itself. There's about 9,500 people that live there. So it's not the biggest community. In Montana, if you're going by cities, it's actually like the 9th largest city. But when you look at counties, there's, of course, larger counties. There's a combined city-county government, which is unique to the area. There's only Anaconda and Butte that have that set up. So that kind of changes the whole way, the inner workings of how the health department works within the city county, because our health department is committed to the city because our county and city are combined. There's a really unique and rich history in the area. The mining history there really kind of shaped the way that the people are very resilient. And in the 80s, when the mainstay of the economy, the smelting and mining, shut down, that kind of resulted in a near economic collapse. And I think you see echoes of that throughout the community today. And that does contribute a lot to the health. And another really interesting factoid there is that Anaconda is designated as one of the largest EPA Superfund sites. So there's a lot of mining waste to clean up. And so that's something else to kind of note when you're thinking about the health of the community. So my competencies and goals I listed out here for everybody. I won't go through the competencies one by one, but my main goals with my project were to develop and distribute the community health assessment survey, collect the results, and then get the data ready for reporting. All right, so a lot of people are public health professionals on this seminar, but I wanted to just explain really quickly what a community health assessment is. So it's a way for a community to kind of process and identify the needs that the people that live there care about. It emphasizes the community engagement by getting other people in the community involved, and I'll talk about that in one moment. And, you know, by the community doing its own assessment, they're able to develop strategies to address the concerns and make that more of a tailored approach to the problems in the community itself. So the process that we followed was gathering the secondary data so we could present that to some stakeholders and see what they wanted to do as far as what they deemed important and what they needed for their organizations. We had to develop a data collection tool and decide how we were going to collect that data, and then collect the data and analyze it and review the findings with the stakeholders and community, and then write a community health improvement plan based on those results. So this is just a quick timeline of my project itself. So in March 2023, I kind of started the planning stages and trying to get that secondary data. In June, we had a stakeholder meeting and got their input on what they wanted. August, I spent a lot of the time developing the survey, using that stakeholder feedback. And then September, October, we finished up the survey and put it out for distribution and started collecting data. Right now, we're just ending the data collection phase. And then I intend to continue working with the health department with my ILE to kind of finish up this stuff, just why I put this extra part of the timeline on here. But in December and January, we'll be looking at analyzing that data and report the results back to the stakeholders. And then February, March, we'll have that completed report and distribute it to the community and get a chip on the books. So the first step was secondary data collection. So where did I find the data? It was really, really hard. This is one thing that really, I guess, kind of surprised me, this whole experience, is that this is why it's important to do these community health assessments, because there is next to no data. The state doesn't have a lot of data. I worked with some epidemiologists there. I used some CDC databases. And then I found another source. Some of you might have seen it. It's called county health rankings, and they compile a lot of data from a lot of different places and kind of check the validity of it and make sure what they put is just statistically significant as they can get. But that's kind of where a lot of my secondary data came from. And then the second step was to get stakeholder feedback. And so we actually had a lot of community organizations there. So like the fire department was there, the school department, Head Start, and then just a bunch of other smaller associations in the community that deal with families and different health related aspects in the community itself. And so I'll go over these really quick. I won't read each secondary data thing here, but I thought it was important that everybody kind of got what we knew before we started this data collection. I think one of the things on here that I'd want to highlight would be that it's an old community. If you look at the above 65 population, you're looking at over a quarter of the people in the community are above the age of 65. And in Montana, it's only about 20%. The community is, just like the rest of Montana, a majority white, non-Hispanic white. And we do have about the same Hispanic population as the rest of the state. And then in the female male ratio there, you can see that our county has a little bit higher male population than female. Here, I think I'd probably highlight, the adult obesity is quite high compared to the rest of the state. So a little over 1 in 3 people there are obese. We're about on line with excessive drinking. Our suicide rate is unfortunately quite a bit higher than the rest of the state. And severe housing problems is meaning like structural, high cost rent, maybe not running water and electricity. So we're about on par with the rest of the state there. A lot of our children are living in poverty. It's a very poor community in general. And then the primary care mental health providers and dentist ratios. One thing I'd want to highlight there is you see that the mental health provider there is 170 to 1. So it makes it look like Anaconda's doing really great with that, but we have to keep in mind that the state hospital is there, and a lot of those practitioners are not public practitioners. So I think that's kind of why we see that. And then just on this last side of the secondary data, our income is obviously a lot lower. The median income is a lot lower than the state. It is a poorer community, and our educational attainment is quite far behind the rest of the state. So we had to develop our data collection tools and methods. So we listened to the stakeholder needs. We had to decide whether or not we wanted to do a paper survey versus a digital survey. And then if we did digital, what kind of platform, because there's a lot of different ways you can do this. And then whether we wanted to do some in-person stuff. So you can probably tell by my middle picture here, we did kind of go with a digital, and I'll touch on that on the next slide. But we also had to decide on our sample selection. So how were we going to get these responses? So we're going to do outreach events, use the clients that are using public health. So like WIC and the different programs that exist there, use social media, or go to the school district. And we actually ended up doing all the above. So we collected both digital and online surveys and paper. When we did receive paper, the public health employees did input them into JotForm. So the final decision was to use JotForm as our platform. The survey is still open right now, so I only really have some preliminary stuff to give everybody, but it's interesting. I haven't adjusted them statistically yet, but I was working on coding it so I can hopefully get that into R and do a little bit more. We needed 370 responses for statistical significance. And if you look over here to date, as of this morning, 389 were completed. And of the 389, 371 of them reported living in Anaconda Deer Lodge County. So we just met it. So that's going to be really exciting. And then once the survey closes, like I said, I'll do some more statistical analysis there. So I picked out a few interesting things. I could talk about this for probably 20 more minutes, but I'm going to try to keep it under 10. So the age ranges of the people who completed, we did, I think, a really decent slice of the community there. If you see, the people who are 65 and plus consisted of about 30% of the completed surveys, which you'd expect in this community. It's an old community. There's a lot of retired people. Our secondary data told us that. We were about right on par with our race and ethnicity. One interesting thing here is the sex that the people reported that completed it. We had a really high amount of females completing the survey versus males, which is kind of flipped from our what we know from the secondary data. And education levels, if you look at who completed, we had a lot of people with a four-year degree and a postgraduate degree complete it, but that's not completely unexpected because usually that's a population that is more likely to complete surveys when they see them. So um, the three most important things for a healthy community that people rated on the survey were access to healthcare, affordable housing, and a healthy economy. And that was closely followed by good schools, about the same amount of a healthy economy and good schools. The three most serious health concerns facing the community that people identified were alcohol and substance abuse, mental health issues, and lack of affordable housing. And then this was just a couple other little questions I put on there. I thought this first one, it was agree, that scale of agree, strongly agree, disagree. This one actually, out of all the questions I had that scale on, showed the most like dissonance between everybody on the survey. There's a decent amount of people who said disagree or strongly disagree here, where a lot of the other ones people were in pretty good agreement. So that's why I included this, because I thought it was quite interesting. Another interesting thing I saw was I asked if people felt prepared for an emergency. 78% said yes, but later on when I asked, does your household have an emergency kit and plan? Over half said no. So that is something that we'll probably need to be looking at going forward. Potential problems that were rated a big problem were illegal substance abuse, legal substance abuse, and availability of affordable housing. And one really cool thing was that a majority of the respondents, about 71% of them, have lived in the community for over 16 years. So that was really interesting as well. So I think the main takeaways here is that the survey was pretty representative of the community in a lot of ways, and that we'll probably be looking at programs to create and address some of those issues like substance abuse, housing, and mental health kind of things. So the next steps here is that I'll be compiling the final survey results when we close it here in a few days. We'll work on synthesizing that data. We'll present it out to our stakeholders in the community and get a community health improvement plan written up. And so I know we're saving questions till the end, but thank you all. And I appreciate all the support Lee and Lauren have given me. And yeah, I look forward to any questions you might have.
Great, Adam. Thanks so much.